Hello, my name is Dr. Savan Hilo. I'm a urologist that's part of the men's health team at Mayo Clinic. In this video, you'll learn about vasectomy. If after watching you'd like to schedule your vasectomy, please complete the online questionnaire or call the number provided to schedule your vasectomy. In a vasectomy, the two tubes that carry sperm are cut and the ends are separated and closed. After a vasectomy, sperm can no longer enter the fluid or semen that's produced during orgasm and ejaculation. It's a permanent form of birth control. Compared to other birth control options, it's very reliable and cost-effective. It's also less invasive than a woman's tubal ligation procedure, also called having your tubes tied. Vasectomy doesn't affect your sex drive or your testosterone levels. It also doesn't affect your ability to get or maintain an erection or to have an orgasm. After a vasectomy, you may ejaculate less fluid, but most often men won't notice because sperm make up such a small part of the ejaculate. Vasectomy is a common procedure. About 500,000 men each year will undergo vasectomy, but about 8% of those men will choose to have their vasectomy reversed. Before having a vasectomy, you should be sure that you don't want to have any more children. Men who are more likely to regret having a vasectomy are men who are less than 30 years old, men whose partner is currently pregnant, and men who have been considering a vasectomy for less than 1 year. Vasectomy reversal is an option, but it doesn't guarantee that you'll be fertile. Success rates depend on how long it's been since your vasectomy. Vasectomy reversal can also be costly and is rarely covered by insurance. There's also the option to preserve sperm in case you do want to have more children in the future. This is called cryopreservation. In cryopreservation, the sperm's obtained and frozen for future use. There's a yearly cost to storing sperm. The sperm that are stored can then be used for intrauterine insemination or in vitro fertilization. Both of these procedures can be expensive and are typically not covered by insurance. Vasectomy is a 30-minute procedure performed in the office. A numbing medication is used so that you don't feel any pain during the procedure, but if you're anxious about it, we can give you medication that will help you relax. If you choose to take this medication, you'll need a driver who can take you home. During the procedure, a small opening is made in the skin of the scrotum to find the vas deferens. The vas deferens is a tube that carries sperm from the testicle to the ejaculate. We then clip, cut, and close the ends. Tissue is sewn between the cut ends of the vas deferens to prevent the two ends from growing back together. The small opening in the skin is then closed with dissolvable stitches and a small bandage is placed over it. After the procedure, you should plan on taking it easy for the next 48 hours. Don't do any strenuous activity or lift objects that weigh more than 10 pounds. The stitches will dissolve over the next couple of weeks. You will not need to return to have them removed. You can also start having sex again after 10 days. About 3 months after your vasectomy, you'll need to have a semen analysis to measure your sperm count. Before you do the semen analysis, you'll need to ejaculate at least 20 times to get all the sperm that are in the tract out. You should continue to use another form of birth control until your physician's determined that your semen does not contain any sperm. Vasectomy is a low-risk procedure. However, all procedures have some risks. For vasectomy, these include hematoma, which is a collection of blood in the scrotum. This almost never requires surgery. It can, however, cause pain and swelling, and it can take weeks or even months to heal completely. Although rare, infection is also a possibility. It can usually be treated with antibiotics. Despite doing all the things to separate the two ends of the vas deferens, that tube that carries sperm, from the testicle to the ejaculate, there's still a 1 in 2,000 chance that the vasectomy can fail at any point in time after the procedure. There's also a 3% risk of chronic testicular pain. This can range from an occasional dull ache to a severe pain that makes it difficult to do your daily activities. If the pain is severe, you may need surgery to reverse the vasectomy or to cut the nerves that go to the testicle. This will improve the pain in most patients. Men at greater risk for chronic pain after vasectomy are men who have had prior surgery in the groin or scrotum, or men who have a history of chronic pain, infection, or trauma to the scrotum. Lastly, vasectomy does not increase your risk of prostate cancer. In summary, vasectomy is a safe, cost-effective, permanent form of birth control as long as you're sure that you don't want to have any more children and you understand the risks. I hope you found this video from the Mayo Men's Health Moments series informative. If you'd like to schedule an appointment for a vasectomy, please fill out the online questionnaire on our website or call the number pictured on your screen. This is Dr. Savon Hilo from the Mayo Clinic. Thanks for watching.